So this is my first time moderating a panel. I've been on these panels a bunch of times. They can be fun. They can be a little stressful. So we're going to try to make it a little bit fun for these guys. So I thought probably the best thing to do was to put together a case study and see if we could tie in all three components of what we've heard about today. You can see that treating concussion really is a multidisciplinary thing. It's not even more so than, say, treating somebody with an ankle sprain, because you're bringing in all these different branches of medicine that have to kind of work together. So I put together a little case study, and we're going to quiz our panel today and see how well they do. The case study is a 14-year-old female soccer player. She reports to you having sustained a blow to the head in her game the previous night. First head injury, no loss of consciousness, but immediate headache, dizziness, nausea, and she vomited once after the injury. Her parents took her to a local ER last night where she was evaluated by a physician. Her basic neurological workup at the hospital was pretty normal, so her central and peripheral nervous system testing function was normal. The ER physician reported some abnormalities in basic visual tracking tests, some sensitivity to light and loud noise. She still has a headache and dizziness and nausea at that point. Her head and neck x-rays were negative. At her mother's very firm insistence, she underwent a brain MRI, but there were no abnormal findings. And although her mother wanted her admitted for more testing, she was, to her mother's absolute dismay, discharged the same night with a diagnosis of concussion. Her father, meanwhile, was seen rolling his eyes multiple times during his wife's medical recommendations. She reports to Plymouth Bay Orthopedic Associates the next day with her mother an ongoing headache, dizziness, nausea, difficulty focusing, sensitivity to bright light and loud noises. Okay, so there's your case study next day. So first question I'm going to throw to Dr. Turan. Do you think all the films performed at the hospital the day before were appropriate and necessary?
Certainly, if there is a suspicion for major injury, neurologic change, certainly it's appropriate to get some scanning. You'll see CT scan being the common one for any whiplash or concussion. But getting an MRI acutely really isn't going to be very helpful at all, most cases. Because you can certainly sort out a lot of acute injuries with a CAT scan, with a CT scan. So an MRI really didn't change a whole lot for the treatment, so it wasn't really necessary at that time. I can see them playing some role if it's later on in treatment and there's certainly something concerning, but it's kind of clinical basis that you need to do a thorough neurologic workup before getting any imaging testing. So.
Great. Okay, perfect. Yeah, that makes great sense. Next question, I'm going to keep this coming to you. This patient underwent baseline neurocognitive testing starting at the start of the season. At what point would you retest her? And Aaron, you can jump in on this too if you want. At what point would you retest her against her baseline? And what, without taking too long, what are some of the key indicators you'd be looking for to determine whether she's returned to baseline?
So again, as I alluded to, the impact test is certainly the tool that we're referring to here when we test their neurocognitive state. And it's very helpful to have a baseline before participation. But then really it's a clinical decision. It's highly variable, as we had said, a lot of symptoms that you really have to keep track of. And I certainly would use a lot of those clinical symptoms, but a lot of reliance on the team to try to understand what's happening, the changes that are happening. And then if there is some change, whether it's over a period of time, again, it's hard to nail down exactly how many days out or weeks out that you should retest, but it's really a clinical decision based on their progress. So if you say you have some change, either it's worsening or maybe they're improving rapidly, or maybe there's just no change at all. I know that could cover a lot of it. It's pretty broad. But if you have a sense of that, then you get the re-impact testing to kind of drill down into those domains and see where to go from there. Because it really can help you kind of put the emphasis of treatment to where it needs to be.
And then let's see, I think I have one more. So maybe the most important question for Dr. Turan, how many times would you answer the same question about when her daughter can return to play before you call your MA and to take vital signs again so you could excuse yourself from the exam room? You don't have
once.
To answer that. You don't have to answer that if you don't want to. So. All right, so I'm going to shift over to Erin real quick. So next thing, patient's mother feels her daughter should be woken up every hour for the first few nights. She's not exactly sure why, but she is completely sure of it. I think Karen from her book club told her. What would you recommend to the athlete and her family regarding sleep in the days following your exam and concussion diagnosis?
So first of all, she's a teenager. So she may try and murder her mother if she tries to wake her up every hour.
Exactly right.
Second of all, they've shown that sleep hygiene can also lead to shortening of the symptoms. So talking about appropriate sleep hygiene, no screens right before bedtime, no screens in the bedroom, appropriate length of sleep would be a mainstay of treatment.
Yeah. So the brain needs to heal, like it needs to rest. In the old days, right, they did wake you up every hour. My mother woke me up every hour when I had a concussion. I almost killed her too. So I think you really have to let them sleep, let them recover. If there's no sign of an emergency medical condition, they should sleep. Next, the patient's mother sees other girls wearing some sort of headgear during play, and she wants to know if this will prevent another concussion, and can she get it at Lululemon? Do pieces of equipment such as mouth guards and or helmets prevent concussion?
So Brett kind of talked about this, that they don't prevent it, and they may cause kids to act more aggressively during play than if they did not have that equipment. The headgear piece to me is actually funny because I was a college goalkeeper, and there was a big trend of people getting that headgear back in the late 90s, early 2000s. They showed that people went into tackles more aggressively. There were actually higher incidences of injury. So I would not recommend that, and no, Lululemon does not carry it.
That's exactly right. So those helmets in football, are designed to prevent catastrophic head injury. They are not designed to prevent concussion. Hockey, football, it doesn't matter. Mouth guards also, no statistical evidence that they prevent concussion. But exactly as the panel's alluded to, is that sometimes athletes feel a little more invincible because they're going in with those things on. So no, equipment is not an answer. Would you recommend any specific medication for the athlete? And maybe more importantly, would you recommend any for her mother?
Loaded question. In pediatrics, you're treating the parent as well as you are the child. So building a rapport and getting the mother on board that you're going to be a trusted member of their medical team is almost as important as how you treat the kiddo.
Agreed. Any specific meds for a kid that's symptomatic post-concussion?
No, medications for kids are pretty much contraindicated. Melatonin has been shown to help some kids with sleep issues, but other than that, not unless there's prolonged symptoms. And at that point, a neuropsychologist would be the one to intervene.
Makes sense. You're treating so many symptoms from so many different systems. There is no one medication that's a magic bullet for anything like this, right? Okay, on to Maddie. And I think you kind of alluded to this a little bit, Maddie, but you can expand a little bit. At what point do you think it's appropriate for a concussed athlete to start physical rehabilitation with you?
I think it's individualized to the patient themselves and what their symptoms are. I think you can see them as early on as a couple of days to a couple of weeks. I think once they've had that initial examination with someone either like Dr. Turan or Erin, once they feel like they're starting to hopefully get back into a normal school schedule, sleep schedule, that is when I would say it's probably appropriate for them to start seeing us.
Perfect. So now your patient, Maddie, you have them at the tail end. So your patient's 3 weeks post-injury. She's been subjectively symptom-free from headache, dizziness, et cetera, for about 3 days. Dr. Turan sends you a report saying that her neurocognitive testing scores have returned to baseline. Her mother is very eager for her daughter to return to place, and she's also very sure that it's only a matter of time before her daughter is noticed by the women's U.S. Olympic development team, is whisked off to some remote location in Southern California to begin her professional career. Now, at this point, would you recommend that she goes back to practice with her team?
So the patient has had neurocognitive testing with Dr. Turan, but the last piece that I would say if they haven't had already is that physical exertion testing that I was talking about before. You want to see they might be symptom-free at baseline, but once you start to increase their heart rate, get their blood pressure up, get them closer back to some specific sport drills that they may be doing, if they become symptomatic at that time, then that would be something I'd say, you know what, like let's hold on this. But if they're able to pass all of those benchmarks as well with the physical exam, then I would say is probably appropriate.
Does it change your opinion if her mother is very eager for her to go back? No, it doesn't. Good. Not a girl. All right. Last couple of questions and we'll move on. How many concussions can an athlete have before they give up sports? What are some strategies to prevent this athlete from sustaining a second concussion? And if she were to sustain a second concussion, what are some strategies to ensure she returns to you with her dad?
So for the last one, I'm not sure, but I think that might be a good idea. In terms of question number one, could ask Rob Gronkowski that question. I think it's individualized to the athlete and what sport they're doing. If they are able to return back to full baseline asymptomatic, back to returning to sports, there's not a clear cut at concussion number 3, that's it, you're done. If they're able to obtain back to baseline, then there is no magic number in regards to that. However, if they do keep having an injury where they're now more fearful of going back to that sport, things like that. A conversation could be had that if they are a multi-sport athlete, maybe, changing in terms of the priority of what you play, maybe switching to a different sport, things like that. For question number 2, some strategies to prevent this athlete from sustaining a second concussion. So there's all the things we talked about working on neck strength, conditioning, balance, things like that. But the biggest component of this is to make sure they're 100% healed from their first concussion so that you don't have to worry about that second impact syndrome that we talked about.
Oh, that's great. So that's great news. Great stuff. We appreciate it all. Any specific questions from the audience? Anyone have any specific questions for the panel?
I used to work in a rehab setting, and I'd work with the elderly a lot, and I just couldn't help but notice there was such a lack of a reference to concussion when they would fall and hit their head, and I would just love your perspective on that. They reference increased confusion, irritability, and sort of blame it on age. So I just would love your perspective. Thank you.
Question basically was concussion more in the elderly population, and whether or not there's less mention of concussion overall in those that are older. Again, probably under-recognized, as we don't, so oftentimes don't recognize in even younger kids, younger than our athletes in high school and elementary school. But certainly kind of more focus needs to be placed on what I talked about, which was it can be an indirect injury. This doesn't have to be a direct blow to the head to have a concussion. We think about that more often. We talk about targeting in football, we talk about those things. But an indirect injury, fall injury, whiplash injury can also cause those concussion symptoms. And we see that as still needing a lot of treatment and focus in a multidisciplinary program like we have and others have. So that's my sense on that.
Perfect. Anyone else? Okay, I think we're all good. All right, guys, thanks very much. Appreciate it. Well done.